Good morning, everyone. I'm Dr. Sara Mustafa from DentistChannel.Online. Welcome to today's webinar about aesthetic facial anatomy. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It is your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first-hand information on the technological advancements in the dental field. Now it's time to start the session about aesthetic facial anatomy. If you have any question about this topic, please feel free to ask it in the question and answer box, and we will answer each and every question at the end of the session. I will start by introducing today's session speaker, Dr. Zafar Abbas. Dr. Syed Zafar Abbas from Pakistan. He cleared his BDS in 2011. He has a postgraduate degree in oral and maxillofacial surgery. He is also certified as an implantologist and holds a diploma in facial aesthetics. Currently, he has started an organization named the Royal Academy of Facial Aesthetics. Welcome, Doctor. It's our pleasure to have you with us.
Thank you very much. My voice is clear?
Yes.
Okay, today the topic of my presentation is facial anatomy. Today we will only discuss about the anatomy and the landmarks, mostly is when we are doing injectables, what landmarks we have to identify and what is the danger zone. Okay, first of all, you can see this face. I hope this is clear.
Yes, doctor, we can see it.
Everyone know there is a masseter muscle over here. Okay, whenever you clench masseter, there is a depression. You can feel a depression over here in front of the masseter. Okay. And downward, there is a artery, external carotid artery. Everyone know external carotid artery. External carotid artery start from here and follow in the depression. Okay. This is the facial artery. When you clench the muscle, you will feel a hollowness. Okay. This is the facial artery. And another way to identify the facial artery is that this is the lethal canthus muscle. Lethal canthus. Downward is the carotid artery and upward is the facial artery, like this. Okay. In same pathway, the carotid artery is present. This is a carotid artery. It extends to the facial artery. Then it supplies the lower face, inferior labial artery. Okay. And it go upward, superior labial artery. Then it supply columnar artery and septal artery. Okay. Can you see the drawing?
Yes, doctor, it's clear.
Okay. Then it go towards the nose. This is the lateral nasal artery. Over here we can feel a depression. Over here is an angular artery. So mostly we avoid this area for injectable. This is the angular artery. And now this is the dorsal artery. Okay. This is the anterior surface. Now we will discuss what about the posterior aspect. The facial artery also start behind the parotid. When the parotid end, they emerge out. This is the arch. Okay. It run behind the transfer facial artery. Also known, this is the arch. Below the arch, there is an artery. Transfer facial artery. Okay. There is a submental artery supplying submental region. Okay. This is the orbit. There is a, we can feel the ridge. If you press your eye, there is a ridge. Okay. Below the ridge, almost 5 to 8 mm, there is an artery, infraorbital artery. And from there is the temporal, superficial temporal artery. Okay. Now, how will you identify the superior orbital and superior trochlear nerve artery? We ask the patient to look in front. As I am looking in front, you can see my iris and pupil. You will mark the medial aspect of the iris, not the pupil, but the iris. Okay. We can see the iris. There will be superficial temporal artery at the medial aspect of the iris. Okay. 80% it comes from the notch, and 20% there is no notch, there is only hollowness. Okay, when you will press, you can feel there is a notch or there is a hollowness. Even when we press the nerve, we feel little bit of pain. Okay. From the orbit, superficial orbital of their ophthalmic artery, 8 to 10 mm anterior, there is an superficial trochlear artery. Okay. It's usually a mesh like this. Okay. This is the artery, facial artery. We during the injection, we should know about this landmark. Why this superficial ophthalmic and trochlear is so important? Because if we mark the danger zone, we usually mark the no injectable area was 1.5 centimeter above this. This is no-go zone. This means we don't want to inject this area. Why? Because when the artery emerges from the foramen, we don't know it is superficial or deep, because there is 100% variation. In every patient, there will be variation. This part will always be variation. But after it crosses 1.5 centimeter, the artery is almost superficial. 85% is superficial. Because when we inject in this area, we go deep. When we see bodybuilder in gym, there we can see proper arteries bulging out from the foramen, but it mostly occur in the upper part. you will not see in this part, because there is so much variation. Sometimes it emerge superficial, sometimes it emerge deep, sometime it between it. So this is a no-go area. We usually don't inject in this area. Okay. And above, the artery is always 85% superficial. So we inject, we go deep, aspirate and inject. Okay. Now we will discuss about the muscle, which muscle we want to inject, which muscle we don't inject. Okay, over here it is. Over here it is posterior muscle. You can see this is posterior muscle. If we want to inject over here, we usually go in this direction, 90 degree. We hit the bone, little bit, withdraw and aspirate and inject our Botox. Okay. Over here is our corrugated muscle. We inject in 2 points, 45 degree, inject, aspirate, 45 degree, inject, aspirate. Okay. Okay, this is our, when you see my frontalis, you can see when I raise my forehead, you can see there is a crest, temporal crest. There is a hollowness. If you see, there is a hollowness. You can see clearly it's a hollowness. Frontalis muscle and over here, over here. But there are some fibers which are extending posteriorly, but we don't go after, we don't go to the fibers. Okay. Where we see hollowness, we stop over there. You will mark this is your ending point of the frontalis muscle. Okay. So I have marked in my model like this. You can see a proper hollowness in my forehead over here. This is the ending of the frontalis muscle. Okay. So this is my frontalis muscle. I will inject over here, here, here. You can see this. This is Orbitus oculi muscle. Usually when patient come to OPD, mostly patient have profit. When they press their eyebrow tightly, you can see there is a line. So we inject in 3 point. How we inject? This is the lethal canthus, 1 centimeter from here, 1 point, 2 point, 3 point, and this is a point for brow lift. We also see bunny lines in some patients like this. When some patients smile, there's bunny lines. Bunny line is by a nasalis muscle. This is the nasalis muscle. We inject in this direction. You also see gummy smile over here. This is orbiculi muscle. This is orbiculi muscle. And there is elevated labia superioris. Okay. We ask the patient, who are here almost from the LR base, almost 1.5 centimeter, we inject our product, almost Botox over here. It helps to reduce the gummy smile. Okay, we have talked about the masseter muscle before. This is our masseter muscle. If patient come with masseter hypertrophy, we mark from corner of the lip to the lobe. This is the ending of the muscle. We clench the muscle. We inject almost in 3 points. Okay, this area is when we are injecting, we have to keep our needles. Okay, first of all, I will tell you about the how to inject in nasolabial. This is a nasolabial fold. Okay, you have two options, whether you inject with cannula or you inject with needle. I usually prefer this area with cannula. We mark the entry with the needle, then we inject our cannula in upward position. Now we start injecting in tunneling like this way. Okay. Sometimes patient come to our OPD and there is a depression over here at the end of the LR base. Okay, there the face is depressed in inward. So we need we press our needle like this. Then we start injecting filler in this position. They give volume and they start lifting the face. What about the sad face? Sometimes patient come to our OPD with lip drop. Which muscle is responsible for lip drop? This is the depressive angular oris. Okay. We ask the patient to make a sad face. Now we know this is a muscle. There is the muscle responsible for this. We give Botox over here. This relax the muscle and it automatically lift. But sometimes we have to inject filler in also in this position to more elevate in this position. With the needle, we inject the filler, we inject the filler, we inject the filler. Okay, I'm sharing my presentation. We've already discussed about the anatomy. This is the external carotid artery. External carotid artery emerge from this. Even you can feel it. How we identify? I'm just revising it. How do you identify? This is my face. This is my lethal canthus. From here, if you go downward, this is the exact point from the external carotid. This is the facial nerve. You clench the muscle. Anterior there is a muscle. to the anterior. This is the extra facial artery. It supplies superior, inferior labial artery, superior labial artery, columnar, okay, lateral nasal, angular, and the dorsal. There is an suborbital and tracheal horn identify the orbital from the medial iris. In superior, there is the from medial iris. This is the orbital, and from 8 to 10 mm mesially, this is the tracheal nerve. Okay, we have already discussed this. Most muscle we should know in our presentation when we are doing Botox, especially. Okay, this is a posterior muscle. We usually, when you are giving Botox, we go almost 90%. We hit the bone. How we identify we are at right plane? From the eye to the eyebrow, we draw two lines in cross section like this. This is the point we inject our Botox. You can see this cross, okay? This is the corrugated muscle, okay? We inject over here. Wait a minute. Okay. This is a frontalis muscle. I've already told there is a depression. This is our, we will not exceed our Botox from over here. Then we will inject from multiple points. This is a no-go area, almost from eyebrow, almost 1.5 centimeters is a no-go area. Okay. These are the bunny lines. We inject on bunny lines to improve the bunny lines. Okay. This is crow feet. We inject in 3 point. If patient asks for brow lift, at the end of the eyebrow, we inject 2 units. It helps to lift the eyebrow. For gummy smile, we inject almost from LR base from almost horizontal line from 1.5 centimeter. We inject 5 units of Botox. Sometimes patient has smoke line on the at the lip. This is the lip. There is a, so we inject almost 1 unit, 1 unit, 1 unit, 1 unit on at this point. For masseter hypertrophy, we create a line from the corner of the lip to the ear. This is a muscle. We inject in 3.5 unit, 5 unit, 5 unit. Almost 15 unit is used in the masseter. Okay. So we have already discussed about the frow line. This is the frow line. We ask patient to lift their frontalis muscle. We can also see the frow line. This is the frontalis muscle. This is the frow line. This is crow feet. You can see this. For eyebrow lift, we inject over here. These are the bunny lines. Over here, there is a smoky lines. When patients smile and we can see the gums of oral cavity, this is called gummy smiles. Sometimes patient have chin line or chin depression. It can also be treated by Botox. We inject at 2 points. This is the mentalis muscle. We inject at 2 points over here. Like this. We can also fill the depression with the filler. Also, there is also some variation in the frontalis muscle. Every patient don't have the same frontalis muscle. As you can see my frontalis muscle, it's same. The line is creating from one side, it end from there. But sometimes some patient come to OPD, when you ask them to front or uplift their frontalis muscle, sometimes there are no frontalis muscle in between, some there is variation. So you have to check first which kind of patient you have in your OPD. So you won't inject over here if there is no frontalis muscle. Okay, you have to be careful about that. And even if there is in patient with type 4, you have to be very careful, because if you inject over here and if there is no frontalis muscle, the eyebrow will drop like this. Okay. If a patient come to our OPD, just like I am in your OPD, there will be two wrinkles line you will see in your patient, dynamic or static. Dynamic line are those lines when patient move their face like this, like this, like this, like this. They are dynamic line that can be treated. But sometimes patient come to OPD which already have line like this. When I'm coming to OPD and I have some crease line on my face, they are static. This means I'm not moving my face, but I have some wrinkle sign on my face. That line cannot be treated by Botox. You have to mix something with it. This means you have to approach something like filler or thread in your practice, or PRP or fat grafting. We already know before the starting of the treatment, we take the patient just like that. I am your patient. You will first take my picture with no marking. I'm looking in front. Then you ask me to if you are treating my frontalis muscle, you will ask me to uplift my eyebrow. Then you will take a picture. Then you will mark. You will do the marking and you will take a picture. Why the picture is so important? Because if patient come to you next time, you should know what have you treated and what point have you already done. So next time you do the treatment at that point which are not injected. Okay, this is one of my case. This, if you can see, there is corrugated. I inject over here almost 1.5 centimeter distance over here, over here, over here. Now you can see the post-op result. The frontalis, the masseter muscle we already has discussed. There's the 3 points we will inject in this 3 point. This really work in hypertrophy. Even in patient with which complain of excessive overloading, you can masseter pain, MPDS. Mostly patient having stress usually bite their teeth. So masseter hypertrophy, masseter hyperactivation occur. So Botox really work when you give in masseter and in temporal lesion. We already discussed about the smoker line. We inject from the lip almost 0.5 mm above, 2.1 point over and 1 point over here. Almost 4 point covering the lip. This is one of my case. I have treated patient with gummy smile. This is not my, basically this is my patient, but I have not placed the bridge of this patient. I have replaced the bridge with my zirconia crown. This bridge was placed by some other doctor. Patient come to me with complaint of gummy smile. So I have treated the gummy smile. So I have planned to replace the bridge with, okay, just I'm telling you about, you can see almost 8 to 10 mm, there is gummy smile, and almost you can identify and posture this proper bone exposure. You can see almost proper gummy smile over here. But after the Botox treatment, you can see I have almost treated 50% of patient complaint. In future, I have a plan. I will give more Botox. So can I treat the complete gummy smile? When I will change the bridge, almost patient will be satisfied and almost 80% patient complaint will be resolved in this case. This is the point we have already discussed. This is for For serous muscle, this is for corrugated muscle. This point are for frontalis muscle. These points are for crow feet. This point is for brow lift. This point is for bunny smile. When patients smile, mostly this for smoker lines. This point is for masseter muscle. Masseter muscle, TMJ pain. This is very much helpful in masseter's pain. This point is for set line. We give buttons at depressor angular oris. They relax the muscle and uplift the muscle. So today topic was all about facial anatomy. So I have not given the detail of the injectable, how much you will inject, what will be your position, what we will cover this in next topic. But today topics was all about the anatomy. So when you know about the anatomy, if you are injecting Botox, you are injecting filler, if you are doing thread, it's very much easy because you know the anatomy. You know which muscle I have to pull, which muscle I will have to keep away from this muscle. If you have any question, you can ask me. I would be very thankful.
I would like to thank you so much, Dr. Abbas, for this amazing session. Meanwhile, I will ask your permission to introduce our company to all the participants, and I request all the participants to kindly put their questions in the question and answer box if they have any.
I think we don't have any question. You can pursue.
Yes. I'm going to share a short presentation about our company. This is our organization, DentistChannel.Online, Healthy Smiles, Wealthy Lives. So DentistChannel.Online is a leading dental media company that aims to spread awareness and knowledge regarding various aspects of dentistry. We conduct regular webinars and courses on different areas of dentistry. Being a prime member of Dentist Channel Online brings you several opportunities, accredited webinars, and dental courses. So if you're not a Prime member yet, kindly join our family to get free certificate of participation after every event and get exclusive discounts and offers on our online paid courses and on-site paid courses and workshops. Being a Prime member with Dentist Channel Online will cost you less than $7 per year. This is an example of the certificate of participation that you will get after every event. About our upcoming webinars, we have a webinar with Dr. Ibrahim Abdel Munim. He will be giving 2 sessions about bonding in dentistry, one happening today at 7 p.m. Indian Standard Time, and the other session happening on Sunday, December 26, also at 7 p.m. Indian Standard Time. We have another session with Dr. Mahmoud Ramadan about implant-assisted overdenture on Sunday, December 26 at 5 p.m. Indian Standard Time. About our upcoming courses, we have an on-site course happening in Cochin from January 6 until January 9, each day from 9 a.m. until 7 p.m. Indian Standard Time. It is a 5 days, 50 hours intensive coaching course with Dr. Muhammad and Dr. Anuj. I request all the participants to kindly send their name on WhatsApp so they will be added to our broadcast list and they will receive everything about our upcoming dental webinars and courses. Today's webinar is sponsored by NovaMind. NovaMind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implants types, called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. Dental implants and dental restorative solutions produced, maintaining all the standards of EU medical device regulatory. Products are manufactured in Athens, Greece, and distributed worldwide with more than 1 million happy restorations. So if you want to know more about NovaMind, kindly check their website. Last but not least, don't forget to follow us on our social media platforms, Facebook, Instagram, and YouTube. You can find our recorded sessions on our YouTube channel and our Facebook page. So now we can move on to the question and answer session, but it seems that we don't have any question. I think everything was clear. I would like to thank you so much, Dr. Abbas, for this amazing session. It was really informative. Everything was clear, well explained. We are looking forward to organizing more webinars with you in the future.
Thank you very much.
Thank you, Doctor. Thank you, everyone, for joining us today. And don't forget to join us tonight with Dr. Ibrahim Abdelmunim. Thank you, everyone. Bye-bye.